The rapid rise in the use of weight loss drugs like Mounjaro and Wegovy is posing big challenges for the long-established dieting industry. Weight Watchers has recently filed for bankruptcy in the US after struggling with debt and the intense competition. The jags are being seen as a quicker way to tackling obesity, but there are also warnings that they're not a silver bullet to long-term good health. Amie Flett has been investigating.
It's weigh-in time at the Slimming World Club in Livingston. Karen has lost almost 4 stone since joining the programme 2 years ago.
It's come off slowly, but I've done it, and as I say, I'm only 2 or 3 pounds off my target, so and I'm quite happy with the way the changes I've made in my life. I don't think I would ever try a weight loss jab. I just wouldn't be able to afford that type of money for that, and I could be spending it on holidays and and nights out with my family and things like that, and friends.
Drugs like Ozempic and Mounjaro have revolutionised the weight loss industry, but not everyone's convinced.
It's not something that I would ever consider. I'm more worried about side effects. And the thing is, when you stop these weight loss injections, how are you going to be after that? Are you going to go back to your old eating habits?
As a group this week, you have lost 49.5 pounds. Well done.
This group averages around 70 members each week. But the industry is rapidly changing. Earlier this month, Weight Watchers filed for bankruptcy in the US as it grapples with debt and tough competition from weight loss jabs. Last year, Oprah Winfrey left the firm's board after turning to anti-obesity drugs herself.
One of the things that I realized the very first time I took a GLP-1 was that all these years I thought that thin people, those people, had more willpower, they ate better foods, they were able to stick to it longer, they never had a potato chip. And then I realized the very first time I took the GLP-1 that, they're not even thinking about it.
And it's something Slimming World say it's had to adapt to.
Weight loss injections and weight loss drugs are here, and the way people are feeling, the way anybody feels when they make that decision they've got to do something about their weight, I can 100% resonate with. And if that's something that they are needing to do, then we are still here for them. We are 100% still here to help them change up their lifestyle and their healthy habits.
As more and more pharmacies begin to stock weight loss drugs, it's clear why dieting groups are being forced to move with the times. But with very few people being prescribed them through the NHS in Scotland, the injections will remain costly for those seeking them privately.
Hi, my name's Laurie, and this is my body after having lost almost 10 stone.
Laurie started taking Mounjaro last year to lose weight for fertility treatment. The NHS turned her down for the drugs, so she bought them online. Throughout her adult life, she's tried multiple exercise and dieting programmes, including Weight Watchers.
I remember going to a Weight Watchers club with my mum when I can't remember how old I was, I might have been about 17, 18, and it was horrific because the first week that I was there I put on weight, which was mortifying. But my head wasn't in it before, which sounds terrible because I'm 30, 34, do you know what I mean? But it wasn't, I didn't have the mental capacity to do the things that I needed to do, but the medication has helped. I did lose 2 stone right before I started the medication myself without it, but I think the fact that I've been able to lose so much more and keep it off for so long has been because of the Mounjaro.
In the last few weeks, Laurie has stopped taking Mounjaro to prepare for IVF treatment, but feels confident she's made enough changes in her life to keep the weight off.
It's gave me the determination to see what I've signed up for a half marathon. I've signed up for the Edinburgh or the Scottish half marathon in August. So that's the goal, is to be able to run a half marathon, having had been a 20 stone person, which I think is mental. I just don't understand how. It seems bizarre because I'm looking at myself and I'm who are you? But it isn't a quick fix, and it isn't for everyone. I've been going to the gym and I think that's one of the main reasons that it's worked so well, and I think that it's the healthy way to do it. I don't think you should just let the medication just do its thing. You need to help it along.
And for some, there will always be a place for the traditional approach, which will give clubs like these hope they do still have a future.
We reflected on some of the points raised in Amie's report with the Slimming World consultant Stuart Malcolm, the aesthetician Jackie Partridge, who's a prescriber of weight loss injections, and the GP Dr. Naushad Ali. Jackie, is this a game changer?
Absolutely. It is basically taking the hunger out of dieting. And so for the patients that we look after in Edinburgh, it is really a tool to help them lose weight. It isn't a magic wand, but it is definitely a game changer because it's taking away that food noise that everybody is associating with when they're trying to lose weight.
And Stuart, is there still therefore going to be a place, we've heard what's happened to Weight Watchers, is there still going to be a place for the traditional weight loss organisations?
Absolutely. At Slimming World, we know that so many people out there need support to lose weight, and there's still going to be a support to get help with changing their mindset and behaviour, and getting help to learn about healthy eating. So people do need support. People need support to eat differently, and they also need support to get more active as well. So there's absolutely still a place for Slimming World. And
Naushad, what is the medical assessment of this?
So in terms of from the medical profession, I mean, we're delighted that we've now got a drug at our disposal that can be used for this purpose. I mean, we know so many patients that have struggled with weight, and we know also that the consequences of weight in terms of risks in terms of blood pressure, diabetes, increased risk of cardiovascular disease. So I think for the appropriate patient, this is a game changer, as Jackie has said, but it's not for everyone. And I think it's really important that we remember that. And this is why, Stuart and Slimming World is still a very important player within this. The medication is a tool within a toolbox. And within that toolbox, we have other things as well, and nothing beats lifestyle changes.
Are there certain groups that you say it's not for everyone, are there certain groups that just can't take it?
So there's some groups that it's contraindicated. So if you have a history of pancreatitis, which is inflammation of the pancreas, then it's not for you. Clearly can't be used in pregnant women, and you need to be careful in women of childbearing age because of if you're on contraception, for example, it can impact on the effectiveness of that. And also the side effects can cause a problem because there are patients who, due to the side effects, struggle to tolerate the medication. So any conversation about this medication, there has to be a conversation about lifestyle and diet as well.
And Jackie, you do proper screening of people that come to you, but not everyone does. We heard of one example, somebody just got it online, and there's a risk to that, isn't
there? So that terrifies me. With all our patients, we do full blood screening, we do medical consultation, we do an in-body assessment where we're looking at the body fat percentage, their muscle mass, their hydration levels. We really want a full understanding of that person before we agree with them if it's the right thing for them. As you've just said, it isn't for everybody, and just being there for somebody and explaining different options, explaining that this is a tool, it isn't going to be a magic wand. So if they carry on eating an unhealthy diet and not doing exercise, they're going to struggle even with using medication.
And Stuart, do you recognise it as a tool? Do you see it as a tool?
We would always welcome someone to Slim World Group, whether or not they're taking weight loss medication or not, because they will need that wraparound support to change their habits around food and around activity. So people can lose. There's a viable option to lose weight without medication, but if someone was taking medication, they could absolutely still come and get the support from a Slim World Group to help with that wraparound support so that they can be successful and be sustainable in their weight loss too.
What about some people that would say this is an easy way out? It's really just about self-discipline. Is it as simple as that?
We know at Slim World it goes deeper than that. To get started with a weight loss journey takes massive effort and support is needed to do that, just to even have that courage to get started. So helping people to really uncover their personal barriers to success, what it is that maybe stopped them before with losing weight if they maybe tried in the past, and that's what we do in group when we give that group support and that individual attention with that particular person too.
You spoke about the side effects. What are they, and do we actually know what the long-term effects are of this?
So the drug is still quite new and we're still learning a lot about the drug, but we do know the most common side effect are gut side effects, constipation, bloating, heartburn. But there's things that we can do, and this is why healthy eating is very important, because one of the ways to try and manage some of those side effects is to actually eat healthier foods and make sure your fluid intake is good as well, and that can sometimes help. But despite that, there are some patients that still can't tolerate it, which is why it's important that lifestyle and exercise and diet are also part of the conversation, because as I say, it's not for everyone.
And Jackie, people will come to you, you're a private clinic, people will come to you, they will pay for it. Not everybody, and I think we heard some people in the report say that, they can't afford it. What, or rather use the money for other things. Does it create a kind of split level, a two-level NHS, a two-level weight loss
two-tier system?
Yeah.
So basically, I think we would all probably sadly agree that the NHS is already a two-tier system. You've got people with private healthcare who can afford to pay for their knee replacement, you know, now, and other people are having to wait 4 years on the NHS waiting lists. So I think perhaps the people who are willing or wanting to pay for this and then maybe not going on holidays or something instead are maybe going to be clearing up some of the space that the other people, if it does become more widely available on the NHS, those people who can't afford it or don't want to afford it, they would then be able to get it through the NHS that way, as and when it does become available.
Is it realistic for the NHS? I mean, they're quite expensive, as I understand.
Very expensive. I mean, I think that's part of the problem, isn't it? That if everyone who was eligible was able to access this on the NHS, I think there's a risk that financially the NHS would be even under even more strain than it already is. And hence, as Jackie has said, I think it's already created a two-tier system where those who can afford it are able to do that. And private clinics across the city and across the country are benefiting from that at this moment in time. But I do hope in the fullness of time that it is something that's available, because as I say, there's many patients who could benefit from it. You both expressed concern about it being available online. What can be done to stop that? I think we have massive concerns about the availability online. We know there's batches out there that when they've been tested have proven not to have any of the actual drug in it. So I would encourage anyone who is looking at these drugs to go to a reputable clinic, and as I say, there's many that will be happy to provide that. But that is a massive concern, and we would discourage anyone from considering buying them online. Social media, I think is a major concern with regards to how they're advertising. What's the actual process, Jackie? Sorry.
If it looks too good to be true, it is. So these offers of, bring a friend, buy one, get one free, it's just got disaster written all over it. This has to be patient safety at the fore, and I think we all agree on that. So yeah, absolutely. Please do not buy this through Instagram, social media.
What is the process? What do you actually do?
If somebody's buying it online?
Well, no, to actually take it.
So the procedure with something like Mounjaro, which is the one that we use the most in the clinic, it is a weekly injection. So some of the sort of counterfeit situations that we're all hearing about are perhaps just syringes with a needle attached with a clear solution in them, and it could be anything from water to pure insulin. But the original proper medication come in pre-filled syringes, which are pens that are like auto injectors. So it's literally pressing it against your stomach, very, very tiny little needle, so it's not painful, and it administers the dose. So it's a completely different setup from the ones that you see on social media.
Is it lifelong though? Once you start, do you have to stick to it?
The manufacturers will talk about this being a long-term medication. In the same way, if somebody had high cholesterol, they stay on statins. If they've got diabetes, it is that sort of idea. But I think as we all start to sort of have more experience of this, and patients have been on them longer terms and using lifestyle as well to sort of change habits, then it could be that somebody comes off this but still gets the benefit of having lost the weight.
Stuart, all the talk about these drugs have come up fairly recently, it seems. Are you surprised at how suddenly an institution like Weight Watchers has collapsed?
Do you know, it's such sad news to hear about Weight Watchers, and do you know, we still know that even with what's happening in America with it now, there's still a place for Weight Watchers too. We've been side by side with them for 55 years. We obviously do it better, but this is where, do you know, in the community, do you know, supporting people to get changes in their community to change their habits. So there's definitely still a place for Weight Watchers, and we would hope that they would continue as well. Definitely.
And encourage people to the lifestyle changes. You think that's every bit as important?
Do you know, getting health to change your behaviours, do you know, particular behaviours maybe around socialising, eating out, do you know, those sorts of maybe situations that have changed in recent years that we do a lot more of, and that's what we can support people to do in group.
And there's no going back, is there?
I don't think there's any going back. I think there's going forward. We know there's other drugs in the pipeline that are probably going to be the data will suggest that they're even more powerful in terms of helping weight loss. So I don't think there is any going back, and I don't think society would let us go back, to be honest, given the fact that these have changed so many people's lives.
And it's hearing it associated not just with weight loss, but there's now talk about it can affect other conditions, improve other conditions as well.
Well, we know that weight is associated with many other conditions, so the benefit in terms of reducing, reversing diabetes. Actually, there's patients now who have shown that as a result of the weight loss that they're no longer diabetic. Their blood pressure has improved, and they're coming off medication. We also know that there's now data showing improvement in cardiovascular health. So, as I say, reduced risk of heart disease and stroke. So, with all these things, the hope is that actually by helping people lose weight, that it may take some of the pressure off the NHS for some of the morbidities, the health issues that patients have suffered from as a result of weight.
There we will leave it. Thank you all for joining us in Scotland tonight. Thank you.